Hello, I am Dr. Miguel Ruiz, and I am an internal medicine physician working at Regions Hospital here in St. Paul, Minnesota. I am also the chief of staff and work also in the palliative care department. I am here today to share with you a little bit about the importance of using professionally trained medical interpreters. Through the years and in my practice working with both Latino as well as patients from many other backgrounds and cultures, some of them refugees coming into the US, others immigrants, I've come to realize how crucial and important it is to have always an accurate communication with our patients. Actually, if you think about it, the medical interview is our main tool, and this is 100% relying on the ability of being able to talk and, most importantly, listen and understand what our patients are telling us. This is the reason why accuracy in communication is going to be of paramount importance. In our hospital, all of our interpreters have undergone a formal training at the university program and have obtained a degree in medical interpretation, which guarantee the fact that the quality of interpretation that they provide is up to standard, and it would be in the best interest of both the patients and the physician. In the clinical setting, we actually sometimes have different options for interpretation. The number one ideal option should be the professionally trained medical interpreters. This is the gold standard and the number one widely accepted way of interpretation that will render the best results. For providers who are entirely bilingual, obviously they are able to speak to their patients in their own language, and this is actually also a very good way of communication. And the problem that one can encounter with this is the cases in which the provider only speaks the language partially. And unfortunately, studies show that providers tend to overestimate their abilities when they speak a second language. This is something that we routinely advise our trainees, our physicians, and the staff in our hospital to be very careful about. And sometimes we are able to provide for them ways of language performance and proficiency testing so that we can make sure that they're able to communicate accurately with their patients. Another commonly encountered alternative is to use family members or friends to interpret for the patient. This is, although easy and convenient, present with several major problems. As we mentioned before, one of the important elements of a proper interpretation is accuracy, and I'm afraid that when we use interpreters who are family members or friends who have not received formal training, their ability to interpret medical terms, understand concepts that have to do with disease, symptoms, etc., can be quite limited, posing therefore a major handicap. Using children for medical interpretation is also a commonly used mistake. It is possible that children may be able to speak English or the other language that the provider may speak, but they are not capable of understanding some of the more complex situations that can be frequently discussed during a medical interview. Also, children may be placed and put in awkward positions when discussing private medical problems, elements of the medical history, traumas from the past that are just simply not appropriate for children to be a part of, especially when these have to do with their parents or older relatives. Therefore, we strongly recommend against using children, actually family members or friends, for interpreting during a medical encounter. Sometimes patients are the ones who actually emphatically wish and demand that their family members may be used or be used as the interpreters. In those cases, what I will recommend is that we make the argument that we actually, providers, physicians, we are the ones who are accustomed to working with these professionally trained interpreters, and therefore it is our preference that we will use them as opposed to use the patient's preferred family member or relative or friend. Therefore, in this way, we maybe less likely to offend the patient who has been adamantly wanting to use a relative for interpretation. You will be able to learn more about the specifics of what constitutes a good, professionally trained medical interpreter later in this course. Language discordance or poor quality interpretations may disrupt the way physicians assess symptoms, other clinical clues, and therefore can lead to misdiagnosis. This is not only inconvenient but also expensive and may expose patients to some adverse effects. Inadequate interpretation also raises important ethical problems. Informed consent is an ethical obligation, and when there is a language barrier, a violation of the basic right can occur. Stories abound about the dangers associated with poor communication between a patient and a healthcare provider. Since young family members often learn English quickly in school along with the language their parents speak at home, they naturally fill the role of interpreter during medical interactions. If a parent does not feel comfortable speaking about private medical problems to a young child, or the young child has not learned the pertinent medical terms, phrases are omitted or unequivocal words are substituted for the message the patient means to convey. This can lead to missed diagnoses, inappropriate imaging, and lead to unnecessary invasive tests or even surgery, which is fairly tragic. One such story involved a Hmong mother who had been sick for a few months. Her teenage son served as an interpreter, and after multiple interactions with the physician, she was sent to the hospital for a brain MRI. A professional interpreter met her at the MRI suite, and the mother asked the technologist why she was having an MRI of her head when her problem was with heavy menses and lower abdominal pain. The MRI was quickly cancelled, and the Hmong mother was able to speak with the help of the professionally trained interpreter to have her true medical problem addressed. Another example, another Hmong female young child interpreted for her, and she had informed consent for what she thought was going to be an exploratory laparotomy for a ruptured ovarian cyst. She signed the consent form and awoke after surgery to realize that she had had a hysterectomy instead. Her husband divorced her and she could no longer have children. A Somali man visited the clinic and brought his English-speaking family friend to speak for him. The family friend told the doctor in broken English that the patient had the disease of being bitten by the dog. The doctor assumed the patient had been exposed to rabies and proceeded to give rabies vaccinations immediately, only to learn later that the patient had been trying to communicate that he thought he had syphilis, a Somali phrase for syphilis being disease where you are bitten by the dog. We could continue giving many examples of situations where lack of interpretation made a big difference for the negative. Many situations caused by the lack of interpretation can be sorted out with time but would not be possible in an efficient screening history and exam as taken by the IOM when interacting with refugees and immigrants. The refugee medical history and exam determines the future resettlement of a refugee and is therefore critically important in that person's life. After being a refugee for many years, people are often fearful that they will be told that they cannot resettle based on their medical history and exam. With understandable but unnecessary unease to disclose medical history and current symptoms or concerns, it becomes even more important for the refugee to be able to communicate effectively with the IOM healthcare personnel. For example, a refugee has an irregular supply of antihypertensive and they were not able to communicate their past medical history with the IOM panel. She then does not have any pills left for the day of the flight, and she ends up having a hypertensive emergency and an ischemic CVA while en route to the US for resettlement. Tragic. Another example of a dangerous health outcome linked to poor or lack of medical interpreting would be a refugee with uncontrolled blood glucoses. He could slip into a hypoglycemic diabetic coma because he found a supply of insulin and took some right before departure screening, since he heard that he must be healthy or he could not be resettled. In summary, we can say that the benefits of applying resources, providing training, and designating enthusiastic people willing to learn the best practices of medical interpreting are many. And with effective medical interpreting, it is possible to obtain accurate histories rapidly and avoid dangerous health outcomes. Let me finish by reminding us all of what medical interpretation is. It is the accurate, complete, and objective transmission of messages between a patient and provider who do not share a language. Thank you very much, and I hope you enjoy this course.